So this is the last session about CBT for depression. Okay, so you're gonna learn some information about depression in general, and then we will do some CBT activities. I think next time we're gonna talk about OCD, like a CBT for obsessive compulsive. Anyway, I'm sure some of you are familiar with medication for depression, right? These are different categories of antidepressant. We have some medications that work on serotonin. We have some medications that work on both serotonin and norepinephrine. Some medication work on norepinephrine and dopamine, and some medication still work on these chemicals, but in different ways. So we categorize them differently, but they are old medication. We really use them as antidepressant now. So these meds have a generic name or the active ingredient and then a brand name. For example, fluoxetine is Prozac, sertraline is Zoloft, duloxetine is Cymbalta. Anyway, it's very complex, the mechanism how these meds works. So I just say, oh, this increase serotonin, this one increase different chemicals. But if you look in details how these medication work, it is so complicated. Lots of my patients ask for how long I'm gonna stay on these meds. Usually, if this is the first or second episode of depression in your life, you can stay on these meds for 6 to 12 months, so almost like a year. And then we can wean off gradually. If it is more than 3 times episodes of depression or severe depression with other features like psychosis or catatonia, usually we tend to have antidepressant for more than 2 years. However, every patient is different, and the decision to start a medication needs lots of experience, and to stop a medication needs also lots of experience from the doctor and the discussion with the patient. I can't put 2 years if this is the third episode, or 1 year if it is the first episode. It's not that simple, but these are, some of the guidelines that we can follow. However, the patient job, the responsibilities, the family history. So if a patient with a strong family history of depression, I tended to think that they might need antidepressant for the rest of their lives. If someone have depression mainly because of situational problems or lots of stressors, and gradually these stressors are resolving, so we don't have to continue on antidepressants. So the decision is not as easy as these guidelines, but usually, again, if it is the first time depression, 1 year is usually enough. Is seasonal depression every year at the same time for the last 10 years, this means we will need antidepressant for more than a year or 2. So I show you lots of antidepressant. Which one we choose to start with? We just choose anyone, like we pick anyone. So there is no specific medical guideline to tell me if you're gonna respond to this better than that or this better than this one. It is all trial and error. That's why I don't want you to feel like your family doctor doesn't have, or your psychiatrist doesn't have a good experience because he tried something and it doesn't work. We all try antidepressant until we find one of them that work the best for you and they have the least side effect. So we start with SSRI or SNRI, the medications that work on serotonin, and then we reassess. So we start a medication, reassess in 2 to 4 weeks. I usually follow up every week at the beginning of antidepressant and see how the patient is responding to antidepressant. And then final reassessment in 4 weeks, in a month. So you start the antidepressant, and in a month, we check how the patient is doing in regards to the depressive symptoms, loss of interest, depressed mood, anxiety, appetite, sleep, all these areas. If we find the full response, okay, we are good. We continue and we are good, done. If there is no response or partial response, we try to optimize the dose. We up the dose. For example, Zoloft, the dose range between 25 to 200. So we'll keep going up until we reach the maximum, which is 200. Okay, and then we reassess again within 4 weeks. So you see, I wait 1 month, then I wait another month when I increase the dose. So you see, 2 months, we are just trying. After 4 to 8 weeks, if I find no response, I will decide to switch. Okay, lots of patients, why I'm giving this is for doctors and not for patient, but I'm telling you this so you know what guidelines we follow when we try antidepressant. I don't want you to try something, then after a week, you feel, oh, it's not working, so I have to switch. No, you see, I can give a chance for the medication to work up to 6 weeks or 8 weeks. I don't know if there is no, sorry, I don't know what happened here. If there is no response, if there is no response, we're going to switch. If there is full response, we continue. What if there is partial response, like improvement 50%? We can combine with another antidepressant, so we can give 2 antidepressant, or we can augment. What do you mean augment? You add a different category of medication to increase the effectiveness of medication. And usually we add antipsychotic or mood stabilizer to just augment the action of the first antidepressant. So why I'm telling you that, because lots of patients ask, oh, why did he give me antipsychotic? I don't have psychosis. Why is he give me mood stabilizers? I don't have bipolar and I don't have mood swings. Why they are giving these meds? Because one of the guidelines, when a medication is not working well, we can augment with other group of meds. When you augment with an antipsychotic, how it work? We don't know. Okay, the mechanism, when we combine these meds, I don't know. I can't tell you exactly what is the mechanism, how they're going to augment each other. But what we know from studies that these techniques and these ways of augmenting action of medication work. The problem with antidepressant is the side effect. And sometimes antidepressant is very effective and it fixes a problem within 2 weeks. But we had to switch to a different one because of the antidepressant side effect. Okay, some people will have heart issues, some people will, this is a common one, sexual dysfunction, fatigue, insomnia, abdominal pain, also the common one, GI, acid reflux, all the gastrointestinal symptoms, diarrhea, constipation. So that's why I follow up weekly when we start an antidepressant to see if the patient have, if any, of these side effects. Usually, if it is a very mild or minor side effect, we're gonna wait, because usually side effect over time, they get better. If it's a side effect are getting worse, we will have to switch. So you see the guidelines for medical guidelines to try antidepressant is trial and error. And then if something doesn't work, we wait few weeks until we decide we're going to switch. As I mentioned last time, antidepressant is not the only treatment. There is something called TMS, transcranial magnetic stimulation. If you try 2 or 3 antidepressant, it doesn't work for you, you can request from your family doctor to refer you for this. TMS looks like this. They will not put you under, you will be conscious, aware of what is happening. They're gonna put this magnetic waves, and usually it is about 30 sessions. The only side effect that I have seen with patient is minor headache, but it is effective therapy. If severe depression with psychotic feature or severe suicide, we might need to use ECT, which is electrical shock, and And again, we put patient under anesthesia. So even there will be seizures happening during the therapy, is minor seizure, but it is very mild. When I was working as a psychiatrist in Egypt, I was doing this job for a year. Imagine, for a year. And I would say this is the most effective treatment I have seen in psychiatry. If I compare medication with psychotherapy, with electrical therapy, this is the most effective one. However, there is lots of stigma around it, and people think it is very painful, but actually you don't feel anything because we put you under when you go for the therapy. Anyway, our CBT talk today is the activity is around suicide. We know the worst complication of depression is suicide, right? And every doctor need to assess the risk of suicide for any patient with depression. And here I put the risk factor for suicide. Like if a patient, lots of patients with depression, they think or they have wishful thinking for suicide or ending their life. But how serious it is, it depends on certain criteria. So as I told you in first session, usually male are the one who commit suicide more than female. And also of older age, like a male, you know, and during COVID, I lost 3 older males with suicide, 3. And this is a big number because of isolation, because of depression, because of so many things happen. I can't say this is because of the COVID restriction, but I would say that these risk factors apply to these patients. 3 of them were males. All of them were above 60 or 65. They struggled with depression. They didn't have enough social support. Another risk factor is previous attempt. So if I see a patient with suicidal thoughts, if they have a previous attempt, this is a high risk. Also, if you have depression and is complicated with alcohol abuse or drug abuse, this is also a huge contributing factor for committing suicide. If you have delusions, this is rare, but it happens. So if you have false fixed beliefs that you are Superman, and then you think if you jump off a high building, you can fly. And I have seen it happen before. So if you lose your rational thinking, or sometimes people, when they are intoxicated and they see things, they see monsters and they see stuff, animals, they see police officers, and then they jump off a building because of what, of the visual hallucination. Of course, if there is family history, you know, this is, if there is family history of suicide and the patient is just like 2 or 3 weeks, I admitted one of my patient to the hospital because she had suicidal thoughts, and also there is a family history. Even it's not a strong thoughts, but because of the family, you need to anticipate what might happen. If they have a plan, and again, if there is no support and other medical problems, could be a risk. So you see, when it's good for doctors to know that. It also is good, it's important for caregiver. If you have a child or you have a partner or your dad or your mom struggle with depression, so it is good to know when it is serious enough, and if someone have these common factors together, this need to be assessed urgently. And the easiest way to handle that is to call 911. That's it. There is a suicide intervention training. You can do it. It is open to anyone if you wanna. It is 2 days training. I did it. I think Brooklyn did it. We did it at the same place like 8 years ago. And you can do it if you want to help people or you want to understand more about suicide prevention. anyway, the activity today is gonna be about suicide. The activity will help you identify unmet needs. The activity will help you to establish a sense of hope if you struggle with thoughts about harming yourself. It help you identify devastating effect of suicide. Also help you to build a supportive network. I have 10 questions about suicide. 10 questions. For the discussion today, you don't have to answer all of them, and lots of them doesn't apply to you if you don't have these thoughts in the past or you have exam now. So it choose out of the 10, choose only 4 that you can relate to. Okay, so the first question is, what problem would be created for other if you took your life? General question. If you commit suicide, what problems that might happen? Also, another question is, what impact would your decision to take your life on other people? Like, what impact on your partner? What impact if you took your life? What impact on partner, children, mother, father, sibling, grandparent, friend, neighbors, co-workers, your pet, community, enemies? And if you have enemies, what do you think effect of you committing suicide on your enemy? And if you have enemy, tell me who's your enemy. So this is another question. What is your spiritual beliefs about suicide? Like, I came from Egypt, right? Religious beliefs are a huge preventative factor for suicide. Lots of people are very depressed and still waiting for treatment, and they have high suicidal ideation and thoughts, but they can't do it because of religious beliefs. So if you have any spiritual or religious beliefs around suicide, let us know what it is. And they it's good. I feel it is a positive factor, because it gives us time until we start. As I told you, antidepressant will take some time to kick in. Another question, what would people say about you at your funeral if you took your life? A weird question. What would people say? You see, we are trying to help clients see the devastating effect of committing suicide. What people would say about you at your funeral. What your kids gonna say about you at your funeral if you do that. What your neighbor gonna say. What you want people to say at your funeral. This is a general question. What would you want people to say about you at your funeral? What would you like to tell others why you wanted to die? What would you like to tell others about why you have wanted to die? Who can you turn to for emotional support? Here is a positive twist. So the first part of question, trying to see when you come, because for the patient with depression, sometimes they misinterpret reality that suicide is just a relief for yourself and for others. But when you answer this question, you'll see it will have a negative impact or on significant other. It has a negative impact on community. It have a negative impact on neighbors, and have negative impact on the whole society. You see, there is lots of studies showing if a celebrity commits suicide in a certain city or a certain country, the suicide rate increased by 13% around this time. So if that's why it is controversial if someone commits suicide, like a celebrity or famous, well-known actor or something. Should we tell the public about it? If you tell the public, what do you expect how the public will react? This is a major impact. Another question, what can others do? Sorry, what can others say to help you feel less depressed? And what others can do to help you feel less depressed? So what do you want others to say to you to make you feel less depressed? And what do you want others to do to help you feel stronger and less depressed? And the last question, what can you do to help yourself to become more hopeful about the future? I think this is a general question. This is a question we can all answer. You don't have to have suicide or not. What can you do to help yourself become more hopeful about the future? These are 10 questions about suicide. You choose only 4 to answer. This is one activity. The second activity is an easy question. We call it Coupon card. Like you have a small card, you create a small card, or on a piece of paper or a sticky note or something. When you write, when I feel depressed, I can, and then you put 3 things. For this example, when I feel depressed, I can get out of bed, take a shower, call my aunt. You can do the same exercise. When I feel depressed, I can go for a walk, exercise, talk to my parent, something like that. Okay, so I want all of us do this exercise. It's easy. When I feel depressed, I can 1, 2, 3 positive things you can do. And another part, choose 4 of these questions, which is what problems would be created if you end your life? What impact of ending your life on these people? Okay. Even if you don't have suicidal ideation, suicidal thoughts, I want you to think about this question just as a preventative measure, okay, to see ending your life, how it's going to affect your community, your co-worker, your neighbor, your friends, and so on. What do you have any spiritual beliefs about suicide? What would what people would say at your funeral if you took your life, and what would you like people, or what would you want people to say at your funeral? What would you like to tell others about why you wanted to die? What can you do to turn it for emotional support? What can others say to help you, and what others can do to help you? And the last question, what can you do to help yourself become more hopeful about the future? So choose 4 of these plus the coupon card. What would you do if you feel depressed? 1, 2, 3. I'll give you a few minutes to think about this exercise, and Brooklyn will run the discussion. Thank you.